Good morning, I'm Patrick Erickson with the Inland COVID Response Joint Information Center. We appreciate everyone being with us this morning. We'll have our daily update from Spokane County Health Officer Dr. Bob Lutz. We will also be taking questions this morning, and to have your questions answered, please share them with us right here on Facebook. Dr. Lutz.
Well, good morning, and I'd like to welcome Jack, who's our new sign language person today. So, yesterday was a nice day. It was a really busy day for me as well. I had a chance to look at two different ways at how we are looking to open up our local community. I traveled to Welpinit, and I met with the Spokane Tribal Council. And at the invitation of Mayor Woodward, I also virtually met with community event organizers for many of our favorite summer activities, such as Hoop Fest, Bloomsday, the Lilac Festival, Pig Out in the Park, Spokane Pride, and events from Negative Split, such as the Windermere Marathon. Now, at a time when we're missing some of the simple pleasures like going out to dinner or maybe hanging out with friends and neighbors, we're saddened by possibly also missing out on some of the symbolic gatherings that celebrate our community. What I appreciated the most about both of my conversations was, first of all, the emphasis on the health and safety of everyone involved, from the casino employees and vulnerable customers to event participants and volunteers. I also really appreciated the ingenuity of the event coordinators who've had to postpone events while holding on to the hope that still they could run their events under new norms. Each of these individuals shared ideas that are reflective of the innovation and creativity that our community is known for. Virtual concerts and competitions, embracing of local entertainers, smaller yet more meaningful gatherings, and the ability to adapt and still go on with physical distancing. They each also shared the support they continue to receive from sponsors and participants, crucial to these events that support local causes and give back to our most vulnerable populations. Something we've started to have people ask is, what is your why? So why are you doing what we're asking you to do? And so for me, it's for my wife and her family, and it's for the people that I work with. And I think it's for everyone that we, again, as your county health officer, really are there to help and serve. And it's also, I think, to the thousands of people who want to get out there for Bloomsday and enjoy maybe the new and evolving Riverfront Park. And I'd like to be able to go to the Symphony this fall. And so that's for me my whys as to why I am doing what I'm doing. I ask all of you, what are your whys and who are you doing it for? Those of us working at the Health District, we continue to work alongside community agencies here at the Inland COVID-19 Response Center to look at data, support our health systems, ensure adequate testing, and provide guidance to keep the spread of COVID-19 down in Spokane County so we can meet the criteria needed to open the door further. I believe if we follow the measures set forth by Stay Home and Stay Healthy and continue to wear masks in public, physically distancing, minimize our non-essential activities away from home, and of course, wash our hands, remembering to save water when doing so, we'll successfully move through the phases set by Governor Inslee. And the sooner we move through those phases, the more likely we'll be able to enjoy our favorite activities and events this year. People always want to ask about numbers, and so what I can tell you is that as of today, we've had an additional 5 cases, so that gives us a total number of 380. We've had, unfortunately, another death, so that gives us, unfortunately, 23 deaths. And currently, we have 9 individuals hospitalized. I really want to thank Mayor Woodward for bringing together the group yesterday of event coordinators. And again, I think it really shows the efforts that we are doing to collaborate, to coordinate, and again, keep everyone safe. So questions?
Well, we have a few this morning from some of our viewers. We would like to know, or we have a viewer that would like to know, have you heard about COVID parties, people gathering to catch COVID on purpose, to get it over with, and what's the health district stance on that practice?
COVID parties, I guess it harkens back to the days of my childhood when we used to have chickenpox parties. I certainly can't support that. I have not heard of that, but I'm also not surprised that something like that is happening. I guess to some degree, to what end are people having COVID parties? Certainly we know that all ages have been impacted by COVID-19, and if it's young people who are having these parties, young people are not impervious to some of the ill effects. We have had young people as young as in their 20s and 30s hospitalized, and there are, again, people who have died of COVID-19 in their 20s and 30s. So public health will never advocate for COVID parties or chickenpox parties or communicable disease parties. It's just really not a consideration.
Another question from our Facebook audience, Dr. Lutz. Could you speak to when you think that we could realistically meet Governor Inslee's benchmark of no new COVID-19 cases in the 3-week time frame?
Yeah, so I think with respect to that benchmark, and I'll use that in quotes, it's a little bit of a misunderstanding. When Governor Inslee put out the no new cases in 3 weeks, that was specifically to small counties, originally 50,000 individuals or smaller, then expanded to 75,000 individuals or smaller to have no cases. That will not be reachable by any larger county in the foreseeable future. And so I think a bit of a misunderstanding. There is not a variance that would be available to larger counties based on that unachievable metric. So what we are looking at, however, is maybe the total number of cases, and again, trying to identify what would be reasonable for a county of our size.
We have another question from a viewer. Is a second wave more likely today than before in our homeless population? Because it seems like more people are pushing boundaries of this reopening.
Yeah, I think we have talked before, and I will continue to talk about the cautiously opening the door because of the concerns of a second wave. We definitely are not out of the danger zone in this respect, and all it takes is an outbreak like what you've seen in other shelters, for example, in other parts of the state as well as the country. We've seen this in meatpacking plants across the country. We've seen it in farm workers in other counties where you have large numbers of individuals who are in close proximity and therefore readily able to share the virus. So I think the second wave is a potential, and that's why, again, we continue to advocate very slowly and cautiously opening up the door going forward.
And to follow that up, what should the county's approach be when it comes to the homeless population here in the area?
Well, again, I think that's an evolving and very dynamic situation. I think certainly because of the physical distancing requirements, the shelters have had to decrease the number of residents who can stay there, which then puts undue burden on other sources of shelters and or other service providers to provide those services. There's no good answer at this point. I know that the city and the county are working very hard to identify additional venues, spaces for those individuals living homeless. There's actually a conversation that I will be in this afternoon to address that very issue. But certainly with physical distancing requirements, essential to keep COVID-19 at bay, those individuals who are living homeless, and again, even within shelters, it provides a potential venue that COVID-19 could spread.
Dr. Lutz, you touched upon this already, but for our viewers who are just joining, could you revisit the topic of our sovereign nations and our tribal governments and the opening of the local casinos? Is that something that you're monitoring, and what would be your report back on that so far?
Yes, certainly. So we know that the Coeur d'Alene Casino opened up last week. I heard that there were lines, long lines, not necessarily practicing physical distancing, waiting to get in. I believe that Northern Quest opened up this week. And as I mentioned earlier in my presentation, I was asked to visit with the Spokane Tribal Council yesterday to look at their opening plans. My sense, certainly in my conversation yesterday, but I do believe even with what was put forth in the newspaper last week about Northern Quest's opening, I think that I am impressed by their emphasis on the health and safety of not only their employees, but also on vulnerable individuals who may be frequenting those sites. I'm concerned at times because, again, I know that the few times that I've been in casinos, I oftentimes see what I would classify those individuals being very vulnerable. And if they're put into unhealthy settings, potentially, we could see little spikes. But again, I'm reassured by the caution and the concerns that are expressed by at least my conversation yesterday with the Spokane Tribal Council. And I believe with what I read last week with Northern Quest, they're also acknowledging those types of concerns as well.
As a little bit of a follow-up to that, for these businesses that are slated to open in one of the upcoming phases, what advice can you give them as far as what they should be doing in the next week to 3 weeks to prepare for that soft opening, if you will?
Sure. Yeah, I mean, certainly a soft opening. Lines that, for example, we're working right now with Greater Spokane Incorporated to be able to provide guidance to businesses that they can use as reference points. Sectors are going to open up differently. There's going to be different needs, but some of the basics are going to exist irrespective of what the sector is. So physical distancing is going to be required. We're still going to need to be emphasizing the cough etiquette and the hand hygiene and hand washing and things of that sort. So there are some basic parameters that are always going to be met. And so, just start looking at that. The guidance is out there. You can go online, certainly what we've been talking about. Look at basics and how can you as a business, how can you ensure the safety of not only your employees but also the customers? Because I do believe, and some of the information suggests this, that individuals are not going to frequent businesses if they feel unhealthy or unsafe in those spaces. And so you want to provide a safe space for everyone. And in public health, we often talk about make the healthy choice the easy choice. And so make it easy for customers to frequent your businesses by providing them and giving them the information to suggest that this is a healthy place that they can shop and spend time.
Thank you. Dental offices seem to have some conflicting information about when they're going to be allowed to open and when they are, what the new guidelines are going to be. Has the dental community reached out to you in regards to what an opening looks like for them with routine services such as cleanings and things of that nature?
No, not directly. There is the Washington State Dental Association. There's a local association of dentists. There's information out there. I think one of the concerns that we have, and one of the reasons why dentists have not been able to perform a lot of their routine activities, is that oftentimes, as you know, if you go in to get a cleaning, the staff hygienist is typically wearing a mask, but that's not an N95 mask. And we know that many of the procedures that are done in dental clinics produce what we call aerosolized particles, which are even smaller than are the respiratory droplets that we talk about for COVID-19, which puts individuals at increased risk. And so I think going forward, to be doing a lot of procedures that are relatively routine in dental offices, we're going to need adequate PPE and probably training for some of the dental workers who may not be familiar with how to wear some of those materials.
And switching topics now, this is one of the more talked about at this point. Can you explain contact tracing and surveillance testing?
Okay. Yeah. So it's a lot. So, yeah, certainly with the governor's focus, and this is not just the governor's focus, but really is sort of a national recommendation. When we look at infectious diseases, let's take COVID-19 aside. When we look at a communicable disease, the first thing we do, and I say we, meaning the epidemiologists and or public health, is we contact the individual and we find out how he or she may have been infected, obviously what kind of symptoms they have, and then importantly, understanding who he or she may have come in contact with that may have infected the individual and or the case may have infected somebody else. And so those are contacts. So part of that case contact investigation is just that. You're talking with the case, learning from her or him how he or she may have contracted the infection and how he or she may have contributed to somebody else getting infected. That's time that can be very labor intensive, time consuming. And so part of our strategy going forward is being able to very rapidly and be able to identify the cases, contact them, talk about any other associations they have, and then being able to connect with those contacts to determine if they are symptomatic and then recommending testing if necessary. Surveillance is a little bit different. Surveillance is being able to have a snapshot, if you will, of the disease in our community, and that's obtained by a variety of different ways. That's going to be a means by which we have more testing. By having more testing, I have an ability to understand the disease across our community. So it's similar but a little bit different. Surveillance is something that we do on a daily basis. We're always looking and watching and monitoring the community for infections and for outbreaks. And then when we identify cases, we then do the case and contact investigation.
And to follow up on that, the governor announced that he's going to be deploying 500 National Guardsmen to help with contact tracing, which you were just speaking about there. What do you believe that's going to look like here in our area?
So it's my understanding that Department of Health, under the governor's authority, has identified up to 750 National Guard from the Washington National Guard to be part of that force of contact tracing. Locally, we've actually looked to create our own team that is going to be working with our own epidemiologists and staff, as well as other volunteers. We've reached out to, for example, the medical schools and the nursing schools and the School of Pharmacy and Eastern Washington's MPH program, Masters in Public Health program. So we're looking at obtaining a variety of volunteers to be able to do that work. We may have to fall back on the National Guard. We're not sure at this time, but we're really trying to, at some level, stand up our own contact and investigation team here.
And going back to the topic you talked about right at the beginning of our broadcast here, do you believe it's reasonable for Governor Inslee to require 0 cases for 3 weeks before moving to phase 2 when increasing testing at this point it looks like it will result in more positives?
Yeah, again, so just to dispel maybe a misunderstanding, the no cases in 3 weeks was very specific to very smaller counties, such as those originally under 50,000, but then expanded to under 75,000 that needed to be met for them to put in a request for a variance that would allow them to move more quickly through the phases that Governor Inslee has put forth. So it's really not applicable to us. And I think there's just a bit of a misunderstanding out there around what that looks like.
Can you give us an update on the testing sites here in the county and how this new approach is working from the one side now going to multiple sites?
Yeah, so I do know that, as I mentioned last week, and I believe it's now available on our website and as well as the website here, there is a map which shows across the county where that expanded testing is available. That said, our Fairgrounds testing site is still operational. We have new individuals. We have the National Guard working with us there. And so we've actually expanded our capacity to do testing across the community. So that's all good. As I've said before, and as I will say again, the more testing that I'm able to do, the more testing we are able to then get a sense of the disease in our community and being able to move more safely forward.
Another question, are you comfortable with some of the smaller counties being able to reopen before some of the larger ones, including Spokane County?
That's a tough question. If I look at smaller counties, such as those north or those south of us, they will come to Spokane for shopping. They may come here to do any number of things. And so it's not as if we have barriers between counties that prevent people from traveling. And so I just think, again, it is what it is. We just have to be aware of the fact that people travel. People will travel. People have been traveling to Idaho, for example, because it's been open a little bit more so than Spokane County. I just think we have to be cautious when we look at those considerations moving forward. We're not an island.
And this will be our final question, just to follow up on that. Are you concerned at all with the border to Idaho and the different guidelines they have at this point versus what we have and the transmission between the two?
Yes, again, this question was asked before, and I hope to have a conversation with my counterparts across the border later on this week. I am somewhat concerned. We know that the amount of testing has not been nearly as significant as it has been in Washington State. They have fewer cases, but we also know that cases are a function of being tested. And therefore, if I'm not testing, I may not have cases. So the fact that they have lower number of cases, although, when you come into the airport at Spokane, it's the Spokane Coeur d'Alene metro area, people travel. And we have people who work in Spokane who travel from Coeur d'Alene and vice versa. So I think we have to be very cautious and somewhat concerned about the change and the difference between how we are approaching moving forward and how Idaho is moving forward. Okay. Well, that was a long, almost 25 minutes. What happened? It just flew. So, well, thank you all. So as I continue to work on my American Sign Language, and here's my coach out there in the audience, so stay home, save lives. No, she's saying I did it wrong, so we're going to start all over again. It's okay, I'm allowed to do this. Stay home, stay healthy, wash your hands, and save lives. Thank you. Have a good day.